I think that when you look at the statistics that 65% of Guam's population is currently receiving food stamps, that is information that's provided by GFT. I think it's very critical that we acknowledge that first and foremost, and that we begin to work on getting many of our people who are presently within that system to transition into other arenas so that they can be provided gainful employment. One way that we can do this is, first of all, the impending military bill is going to present tremendous amount of opportunities and challenges for our people. One of the opportunities is that it could conceivably translate into higher paying jobs. Now, are our people prepared to be able to fit into that system and to be able to acquire those high-paying jobs? One of the things that we need to do is certainly focus on training, providing the necessary training for individuals. I think any individual that is able-bodied, that's receiving public assistance, we need to partner with them and work with the government agencies so that in fact they can reach out and provide the necessary training and get them ready for what is coming down the pipeline. And that is that in fact there will be opportunities down there, and we need to match those opportunities with our people, the Guam residents.
Both active and retired public servants have the worst health insurance plan in the nation. If elected senator, how will you gain the confidence of the people of Guam that you care about the health of their families when the government can't even take care of the families that it is directly responsible for?
You know, the difficulty with healthcare, it's not a Guam problem, it's a national problem. In fact, it's a global problem. And I think that we come up short. The cost of healthcare has continually climbed, and can we really afford to provide all the care that people expect or demand? And I think there have been different ideas proffered forward to better provide better health care for our people at a reasonable cost. And I'm afraid that we haven't found that niche. And for our people, I say we need to work harder at it. But I don't have one specific idea on how to make it best. If you look at our national perspective, all kinds of attempts have been done, and we have not come up with the perfect solution to providing the best health care for our people. And if the national perspective hasn't been reached, it might be difficult for us because we're dependent on the same formulas to provide the best care for our people.
Well, during the 28th Guam legislature, I introduced legislation to buy ourselves back into the Medicare plan. Unfortunately, when that bill came up for hearing, Public Health and Social Services came and testified that there was no need for that employees, when they reach 65, can actually buy themselves into the plan themselves by just paying the regular premiums. And so that legislation died in the 28th. In trying this year, I read the actuarial that was commissioned by the government of Guam, and I think what we need to do is we need to reestablish GMHP as it was originally intended 30 years ago. I was one of the persons that was working with Governor Berdalio at the time and Jackie Wilkinson to establish GMHP, and the actuarial that was commissioned recently actually says that that probably is the best plan, is to go back into either self-insurance or to have one single insurance company that's going to cover the government of Guam and provide for almost universal health care for everybody.
I support universal health care for our island that would be accessible to everyone, not just government employees or retirees, but to private sector employees as well. So I would support and help draft legislation for universal health care. And I'd like to take the profit motive out of the provisions for health care in our community, because that's what makes it very difficult. When you have a profit motive involved, people are denied the opportunity to access health care because they can't afford it.
The Government of Guam group health insurance plan that we speak of has been around for many years and was primarily intended to provide greater benefits at a lower price. The system has essentially devolved to a point where only one producer or one provider of health insurance is coming into the government. I think one of the improvements that can be done is to bring in an advisor from off island that is more knowledgeable than the ones that we've had in the past who have not been actuaries. We need an actuary in the health insurance area to come in and provide some real guidance for our government employees and directors on what is the best package that can be obtained. I'm not so sure that I can say and agree that Gov Guam is the best or is the worst in the nation. I think that we're going through the same problems that nationally other communities are going through. I do believe that we've got to get rid of the retirees out of the package because they're the ones that use the highest utilization of health benefits, which causes everybody in the active sector to pay such large amounts. There are alternatives. I have discussed some of them with Joe Snogestein at the retirement fund, the health group over there, and I think that we can come to a solution.
You know, the government of Guam has consistently underfunded the health care and health insurance of both active and retired employees. This year alone, active employees got about $2,000 from the government of Guam towards their health benefits, whereas the national average is $10,000 for public employees. I mean, how can we as a government say that we care about people's health and well-being when we don't even take care of the people that we're directly responsible for? This is something that needs to be rectified, and with my universal plan, not only will we take care of not just the government of Guam employees, active and retirees, but we're going to take care of each and every single person on our island to ensure that everybody has the quality of health care that they and their families deserve.
I think that in terms of being able to provide for both active and retired public servants a better healthcare insurance policy and a better healthcare system, one of the things that we certainly need to do is bring the stakeholders into the table so that in fact they can be part of the overall discussion. You know, when you hear about premiums increasing by 100% from $1,500 for a family up to $3,000 in one fell swoop, and our people are only given 30 days to be able to prepare for that, that's a significant output in terms of, or requirement in terms of the families and being able to pay that premium prior to, or that deductible prior to being able to receive health insurance assistance. And that's one of the areas that I think we need to do, is bring the stakeholders into the table so that in fact they're part of the discussions, and ensure that whatever we do, that we work on providing the best possible health care plan for not only the retirees but also the active employees. This also is a little bit more far-reaching because it's a community-wide issue, regardless as to whether people work in the public system or people work in the private sector. That's also another aspect that we need to address in the long term.
The Port of Guam is critical to our island, but off-island shipping companies are trying to get the people of Guam to invest tens of millions of public dollars into buying more cranes so that we can speed up the turnaround time, which would increase their profits. After the projected buildup is over, the people of Guam will be left paying off a huge debt for cranes they no longer need. Do you think that this is a good idea for taxpayers to once again subsidize the profits of big off-island corporations?
You know, I'm never in agreement for the people to subsidize any big companies and so forth, because they have the funding to do so. These cranes that are needed at the port, we know they've been needed a long time. We have a lot of strong, with the military buildup. I mean, this is an example. If everybody's so concerned about the military buildup, use some of that funding that's coming in supposedly from this military buildup to buy these cranes, because we have to work as good neighbors. So as good neighbors, I really believe some of this money should come for all that federal funding that's coming. Well, actually, it's not even federal. It's billions of dollars being siphoned, coming in from, let's say, Japan and so forth. So if Japan is willing to give billions of dollars to the government for the infrastructure, they should be able to negotiate and put these cranes for the port, since the port is a big part of all the needs of the island, into this.
I think one of the things we have to look at is that it's not just subsidizing the big companies. We need to be able to efficiently move those containers off the ships and have a decent turnaround. But more importantly than that, what I did in the last legislature was, I have friends in California who are in the crane industry, and they told me that the Port of Los Angeles and the Port of Long Beach had cranes that they were willing to sell, because they have the smaller cranes and they now have the superliners in the States, and they wanted to get rid of their smaller cranes. I went to the port and I presented it to the board and asked them to contact the Port of Los Angeles and the Port of Long Beach about purchasing their cranes, which I was told you could